So, is now I invite Samita to talk on her presentation on waste management. You can just connect to mine. So, but I think, yeah, I knew it. So the thing is, the last year when we attended the European Society, the ESCRS, they went so far ahead as to stop giving us kit bags, and they made the entire conference vegetarian because it's the meat that causes a lot of carbon footprint, and they kept the air conditioning down. Yeah, and they give us water bottles to refill. So, I mean, if the whole world is looking at it with smaller numbers, we are such a huge community. If you look outside, I mean, so much of wastage will be done. So maybe it's a good time to start thinking.
And as the lowest amount of recycling that happens almost in the world, I think we really need to buck up. Today, thank you, Dr. Samresh, for putting together this IC on sustainability. It's absolutely the need of the hour, and I'm glad that at least All India has given us this sweet little below ramp room to kind of start the conversation. So today I'm going to talk about waste management strategies, and we have Dr. Haripriya here who's going to talk about reusables. And every piece of literature that I looked at had Arvind as the kind of the place to kind of copy and the mentor of everyone, including the American Academy and European Academy. So I'll leave that part to ma'am, but I've been asked to talk about plastic and paper. So we'll just go ahead with that. So this is one of the photos that was published in the National Geographic. A photographer, Justin Hoffman, he won the Photographer of the Year. And one of the things that hit me when I looked at this photo, being a scuba diver, and all of us are very familiar with the piece of trash in this photo, which is the bud, because we as ophthalmologists do use it. It kind of hit home for a lot of people globally. So, why is this the need of the hour? Why do we need to look at where our plastic goes? So, yeah, microplastics have been found in every human placenta tested recently, and so the next generation is basically going to be plastic. All your children and grandchildren will be Barbies and Kens. So that's why we really need to take a look at this closer. So, healthcare in general globally is responsible for 4.4%, which means that if healthcare was a country, we would be the fifth largest contributors of global emissions. And 71% of this arises from manufacture, use, and disposal of medical supplies. So, we are all the culprits sitting in this room. Okay, so over 14,000 tons of waste is generated, and 20 to 25% of this is plastic. Approximately 35 to 45% of this is also paper. And almost 90% of this plastic ends up in landfills, and almost 70 to 90% of this waste is actually not biohazardous at all. So it should not be going for incineration. So the problem is that at source, we are making some big mistakes, and we'll take a look at it. So how does one achieve environmentally sustainable healthcare? Energy saving, renewable energy, environmentally wise product purchasing. So reduce the purchasing and look at reusables. um, Looking at re-engineering a lot of our products. So we need to have some serious conversations with pharma and product manufacturers to make reusable products as well as recyclable products. And of course, like Dr. Samresh said, food choices, composting food waste in larger institutes and hospitals, and choosing more plant-based options, and giving lesser and wiser choices with pharmaceuticals as well. So, although these numbers are post-COVID, so they are a bit higher than what was usually there in 2019 and early 2020. You can see that the waste that is being produced within our country is way beyond the amount of capacity that we even have to treat the waste. So actually, most of the waste that's supposedly going into biomedical and management for incineration and being managed by the plants isn't actually even going there, because the treatment plants cannot handle that volume of waste. So where is it going? And you can answer that question when you do a drive between any two cities in India where there are rivers and tributaries. You just look there and you will see all that waste, and a lot of it is medical waste. So, um, one of the studies I looked at, so just to give you perspective, AIMS produces 25,000 kilos of waste a day. So if we think about the numbers, 90% of it doesn't need to be in that waste. It can be segregated, separated, and recycled. That would make a huge difference. So these are the UN numbers of the countries that mismanage their plastic waste. And as you can see, India is, as usual, the one of the top countries. India mismanages 85% of the plastic waste. So we really need to look at what we can do. So of course, the three rules of sustainability, the three R's is reduce, reuse, and recycle. And the first one being reduce, which I think ma'am will talk about, and also reuse, ma'am is going to talk about. But basically, Arvind being one of the places that has such high volume, generates only 1/20th of the amount of emissions that any hospital in the United Kingdom does. So you can, and the end of the mitis rates are the same or less. So what are they doing? We're looking forward to that. And of course, the bed sheet story, where they speak about using a bed sheet until it tears, then it becomes a pillow cover, then it becomes a rag, and until you can use it till its last day and it's usable in any form, it should be used. So what is recycling? Um, First of all, we segregate and dispose our medical plastics, which hopefully should go into a sterilization if it is really needed to. And then you sort and segregate it, and it goes into several different types of recycling, which I'll talk about. And then you have your end product or your recycled product. So when we look about plastics in medical applications, you'll see that most of the plastics are actually single types of plastics, but unfortunately, there are additives or coatings done on these plastics which make them unrecyclable. So we need to actually hold the producers and pharma responsible. And even though India, the government has given kind of 2030 as the deadline and asked them to change these policies, not much is being done about it. There is talk about a magical monomer being developed that will have all the qualities to recycle without producing further pollution during that recycling. But so far, we have not seen much. Of course, bioplastics are a promising thing, but they don't match up to the regulations such as, fireproof, childproof, easy for elders to use. So that's also a thing. So recycling, when we look at plastic recycling, there are 4 types of recycling that can be looked at. One is basically like what we do for PET bottles. So it goes from PET to PET. Basically, the same compound is remade into the same compound. The secondary type of recycling is that basically mechanical processes are put in, and this compound is turned into another kind of plastic product. So also, as healthcare owners and hospital owners, we should be looking at these secondary compounds to use in our buildings, because that completes your loop of sustainability. So some of these things are like panels or tiles. So a lot of these things are also very, very durable. So you should look at also using sustainable products. The tertiary recycling, which is something that I personally do in my clinic, although it's a small volume clinic, is we can collect all the plastic waste that we have and we generate, especially those that actually don't touch the patient. So apart from your drape and your syringe and your one tube, actually none of your other plastic touches your patient. So technically it's not a biohazard. So when you are doing your surgery or you're seeing your patient, you should be sorting at source. So when you sort at source, you will realize that almost 90% of the plastic that you're sending to the biomedical waste actually can go in for recycling. So we have a separate recycling drum that we fill up, and there is an organization in Pune called Keshav Sita Trust that does the tertiary type of recycling, where they take any and all recyclable plastics and some with additives as well, and they break it into pellets and turn it into polyfuel. And there are many organizations who are doing this. I'll just take 2 minutes more, Samresh. And of course, the 4th type of recycling is energy generation with incineration. But honestly, none of our biomedical units are doing this. So I've already discussed the challenges. Some things that will help us would be color coding of the plastics by the manufacturers, so we know what kind of plastic can go where. And these are the things that we can do. So I'll just run through them. Of course, we should share the burden. No offense to any of these companies; they make great products. But look at uh, the packaging. It's like as if we are presenting a gold coin to someone at their wedding. Why does that bottle need 3 cases, one plastic tray, and then be put into the box? This is not even a government requirement. So we need to talk to these companies and we need to ask them why they're presenting them in this manner. And also all of those gifts that pharma gives, and I bet all of you have experienced this, they'll bring all these nonsense gifts that are of no use to us. Even our staff doesn't want to take that stuff. So basically what happens, it ends up into the bin. So definitely, like I already have told you, monomaterials should be used, water soluble glues should be used, minimize the use of pigments, and use materials that can be separated and recycled. And we as societies and associations need to start driving this to pharma. So segregate, make people understand the value of recycling, tell the biomedical people or your organizations that you get in touch with that this is not biohazard. You can collect this from us. We are ensuring that this is not biohazardous. And reusing after sterilization wherever possible. Of course, whatever we are discussing today is just the tip of the iceberg. There is so much more. People are doing entire degrees, jobs, and PhDs on sustainability. And this is how I collect my waste and give it to an organization. We can swap out simple things so that plastic bud that seahorse was holding in my clinic, all buds are now paper buds. You can also use bamboo buds. Keep the disposable sheets small. Reuse any outer packets. So the packet that comes for the BSS now goes to my phaco machine to hang to fill in the fluid. So that packet is used a bunch of times for different things before it gets discarded. And then replace cotton and tissues, because cotton is actually a very unsustainable product. Replace it with bamboo. Bamboo tissues are now the same price as wholesale cotton or normal tissues, and very biodegradable, very easy to grow, very, very sustainable. We reuse our bottles. So these are the OT patient bottles. We will put the date on it and then we will use it as dilating drops in the OPD, so that we have that sterility for the OT patients, but at least you keep using these bottles for a month or so after, so that you don't throw these bottles in the OR. Find organizations, these are organizations that use chips packets and non-recyclable products, packets into beautiful products like bags or t-shirts. There is an organization that uses face masks and makes amazing t-shirts. You can find these organizations. Choose the sustainable materials yourself. Of course, for paper, go digital. Use QR codes so people can scan them and get the information instead of putting thesis size booklets into their files. Go give paperless receipts. Use recycled paper wherever possible, and email reports to people. So just this is my last slide. Little things that you can start in your practice today is go electronic, find a recycler. There is a website called dailydump.org. They have recyclers all over the country listed in them. You can contact them, see who can pick up your waste, segregate at source, and you can save money too, because you're not going to be paying extra kilos for biomedical waste. Reduce single-use items, reuse multi-use drops, and form a working group within your organization, and of course advocate for sustainability. We only have one planet, so have those discussions.